Have you ever thought that cleaning your ears was a good thing to do? You may have used an ear candle, a cotton bud, or even an ear cleaner. Let's be honest, it can feel good. You see some wax and hear a little pop. Then you think, that's it. There is a catch though. Your ears clean themselves. Most of the time, trying to clean them makes things worse. I'm Dr. Calvin Prescott, and I'm here to remove eye wax. This is the first part of a series that will bust a big myth. Trying to clean your ears often does more harm than good. It's possible that clean ears is not a real thing, but people think it to be. A lot of us have grown up thinking that earwax is dirty and needs to be cleaned out regularly, that skipping a week or even a day is dirty. So we carefully swab the inside with a cotton bud or a Q-tip. Some people have tried the cool tech items you can buy online, like ear vacuums, curette tools with cams, and even ear candles that say they can melt wax. People sell these methods as smart ways to keep clean. They are sometimes even called ear spa or home grooming. But doctors have told people for years not to do this. When people use cotton buds, they often damage their ear canals. Over the 20 years from 1990 to 2010, more than 263,000 kids under the age of 18 went to emergency rooms in the U.S. because cotton buds hurt their ears. Every year, more than 12,500 people come, which is about 34 kids every day. 77% of the time, kids got hurt while cleaning their own ears. The most common problems in these situations were feeling like there was a foreign body in the ear, nearly 40%, bleeding, burst eardrums, about 25%, or damage to soft tissue in the canal. Some kids had lasting hearing loss, dizziness, or balance problems, even though most of them went home the same day. A lot more people get these kinds of accidents than we think. It's not just kids. Adults also end up in the ER after getting too excited with cotton buds or other sharp items. Reuters said that about 36 kids are treated every day in the U.S. for ear damage caused by cotton buds. Professionals tell us not to put anything in our ears that is smaller than our elbow. Another big red flag is ear candles. Some people still light the end of one of these empty cones and put it in their ear. They think it makes suction that pulls the wax out. But tests show that the suction isn't strong enough to get rid of the wax. The dark stuff inside the candle is just burned wax from the candle itself. They are also very dangerous because they can cause burns, ear canal blockages, and holes in the eardrums. Most health officials are clear. Ear candling is not safe and doesn't work. Home ear vacuums and video curette kits are another trend. You can see wax being sucked or pulled out on your phone screen, which makes these look cool and high-tech. But most people who use them aren't taught how to tell how deep a canal is, how to use tools, or how to understand the delicate anatomy inside. If you move the scoop the wrong way, you could scratch the skin in the canal, push the wax deeper, or even puncture the eardrum. So why do these accidents happen all the time? We want to clean our ears because of this. It's highly advertised, feels good, and seems clean. Things aren't that simple though. It can be much more painful and expensive to fix that tube, or even worse, a hole in the eardrum, than to just leave it alone. What does it really feel like inside your ear? Earwax, also called cerumen, is made by cells on the outside of your ear canal. It's made up of oils, dead skin cells, and some cholesterol. Because wax is sticky, it catches dust, dirt, and even small bugs, keeping them from getting to the sensitive eardrum. The smart part is that your ear cleans itself. When you chew, talk, or yawn, your mouth moves, which helps the skin that lines the canal move outward. This process slowly moves the wax and particles that are stuck out toward the opening of the ear. When wax gets close to the skin, it normally flakes off or comes off in the shower. So, unless something is wrong, your ears are working fine. They're pretty good at it too. Studies show that wax migration works for almost everyone, even those who have blocks. If your ears don't hurt, itch, or make it hard to hear, leave them alone. Not sure why wax can be seen. That's also fine. The different shades of wax are all healthy. They can be light gray and flaky, dark yellow, or brown. What should we expect if we try too hard to get rid of it? First, using cotton buds to dig tends to push wax deeper into the canal, where it gets squished up close to the eardrum. That could hurt your ears, make the wax harder to get rid of later, or block your hearing. Second, small tools or buds can nick or scratch the skin of the canal, which can lead to an illness or irritation. Keep in mind that these activities can cause otitis externa, also known as swimmer's ear, by breaking or scratching the skin in the canal. Third, canal skin can get dry from being cleaned too much. For that layer to stay moist, it needs wax. Without it, the canal gets red, itchy, and painful. You might want to scratch, which could lead to more tools, harm, and illness. Fourth, people with pierced eardrums do get really sick sometimes. 1/5 of the injuries kids got from cotton buds were to their eardrums. That hurts, and you might need medical help or even surgery. So why do we do it again and again? It's a mix of habit, advertising, and just not getting it. People buy cotton buds to keep themselves clean. With the ear candles and toolkits, it looks like a way to take care of yourself. But making it into a modern form of self-care doesn't make it safe. In fact, it might be making things worse instead of better. Doctors say that people should do nothing until they start to feel sick. The American Academy of Otolaryngology says that if the ear works properly, you shouldn't remove earwax regularly. Instead, use a warm towel to clean only the outside of the ear. Let nature handle the rest. The lesson is hard to understand because it goes against what you might think. It makes us feel good to clean, but most of the time, it's just extraneous distraction. Certain glands in the upper third of the ear canal make earwax. These glands make oils that mix with hair, dead skin cells, cholesterol, and fats to make squalene. Cerumen is made from that mix. It has a waxy feel, but is much more complicated than it sounds. This mix is important for 4 reasons: keeping dust, pollen, bugs, and other junk inside. The skin inside the tube by lubricating and protecting it. Keeping the surroundings acidic keeps microbes that aren't wanted away. It acts as a shield against germs and is full of peptides that kill them. Let's look into each one. A sticky net for dirt and dust. The first thing earwax does is mechanical. Because it is sticky, it picks up dust, flying particles, and even tiny bugs. As the skin inside the canal sheds all the time, these get stuck. The skin then moves outward like a conveyor belt, carrying the wax and other waste with it. This movement starts at the eardrum and moves toward the opening of the ear. Chewing or moving your mouth can help with this. The wax wears off over time or is washed off in the shower. Studies show that this way of cleaning itself works for 99% of people with no problems. Making sure skin stays healthy and damp. The skin inside your ears stays soft and healthy thanks to earwax. That skin can get dry, itchy, sensitive, and even cracked without it. The natural oils and lipids in cerumen keep it soft and immune to damage, like a protective lotion. If you over-cleanse or use strong methods to get rid of this wax, you could leave your skin dry and inflamed, making it more likely to get an infection. Putting up a wall of acid. The pH of cerumen stays around 6.1, which is slightly acidic. A lot of germs and fungi have a hard time living here, so they can't take over the ear canal. Hey, without this acidity, the warm, dark tube of the ear would be a great place for germs that cause infections like swimmer's ear, otitis externa, to grow. Using peptides that kill microbes. Things get really cool from here on out. Earwax has a mix of antimicrobial peptides, which are small proteins that kill bacteria and fungi that are dangerous to the body. Among the 10 important peptides found in human cerumen in 2011, there were beta-defensins, HBD1-3, LL37, lactoferrin, BPI, HNP13, and others. They don't just float around. These actually kill microbes. Tests in the lab show that Ceramin can kill or stop common bacteria like E. coli and Staphylococcus aureus. They can kill E. coli, Pseudomonas aeruginosa, Haemophilus influenzae, and Candida albicans, and sometimes they can kill more than 99% of them. Researchers have also found that Ceramin can kill Pseudomonas and E. coli, bacteria that can cause dangerous ear infections and even meningitis in some cases. In addition to these, proteomic analyses have found thousands of other proteins and peptides that are only found in earwax. Many of these are connected to immune reaction and inflammation control. It's not just a wall, it's like a small, highly armed fortress inside your ear. Why this is important? Because earwax does so many things. Getting rid of it takes away its defensive properties without need. You remove its protective coats, make it less acidic, and take away its germ-killing peptides. That can make the ear canal dry, sore, and more likely to get an infection. Even worse, cleaning too much can push dirt deeper into the ear canal, which can block it, put pressure on it, and even cause hearing loss. Of course, people can make the worst do-it-yourself mistakes, like perforating the eardrum, when they dig too deeply too often. Ideas from the real world. Doctors from UT Physicians talk about how earwax traps tiny bugs and keeps them from infecting you. Bugs that try to get into the ear generally get stuck in the wax and don't get to the eardrum or other sensitive parts. A wet cloth should only be used to clean the outside of the ear, they say. Never put anything inside. Most people get better on their own, and earwax keeps your ears clean and healthy. When cleaning with plants might not work, still, every ear canal is different. In some cases, normal earwax migration can be slowed down. This can happen because of narrow canals, genetics, or conditions like Down syndrome. This can make wax harden and build up, which can cause pain, pressure, or even bone loss in the worst cases. That's why some people need to have regular checkups with a doctor to deal with buildup. In the end, a lot more goes into earwax than just being trash. It's a sticky trap for bugs and trash, a moisturizer for skin on the canal, an acid shield to stop the growth of microbes, a chemical defense system full of peptides that kill microbes. That's why removing something too soon or too forcefully can hurt more than help. What are some signs that earwax is getting worse? Most of the time, earwax gets rid of itself. But sometimes it builds up and gets impacted, which means it blocks the tube and causes problems. Up to 6% of adults in the UK, and a similar percentage of adults in other countries, have wax that gets stuck in their ears. This makes it a pretty common problem. These are some warning signs: hearing problems or a drop in volume. Having a full or painful ear pain or discomfort. Sounds like ringing, tinnitus, or buzzing. Making you feel dizzy or off balance. Coughing, because the canal is linked to the vagus nerve ear fluid, which is often a sign of an infection. Earwax or a more serious problem could be to blame if you have any of these signs. So let's talk about what to do next. Things you can do at home without risk. It's usually safe to try these things at home when your symptoms are mild and your eardrum is still whole. 1. Drops that soften, ceruminolytics. These are over-the-counter medicines that are made from oil, olive, almond, mineral, water, saline, or peroxide, carbamide, hydrogen peroxide. To soften wax, clinical rules say to use drops twice a day for 3 to 5 days. A Cochrane study found that any of these drops are only slightly helpful, increasing the amount of wax that can be removed from 5% without treatment to 20% with drops. Side effects are rare and generally mild, like itching, mild pain, or a short-term change in hearing. If your eardrum is punctured, you have an ear infection, or you just had surgery on your ear, do not use peroxide drops. Talk to a professional first. 2. Irrigation with warm water. Once the wax is soft, it can be flushed out with light watering. A rubber bulb syringe and water that has been boiled or sterilized and warmed to body temperature should be used. Don't shoot straight for the eardrum. Tilt your head and slowly move the stream along the wall of the canal. Stop right away if you feel pain or pressure. After that, tilt your head back and gently dab the ear with a soft towel. If you have had surgery on your ears, get infections often, have a torn eardrum, or use hearing aids, you should never irrigate your ears without first talking to a doctor. Ear lamps not only don't work, but they can also hurt you by burning, blocking, or even poking your ears. Video curettes or home vacuums may look high-tech, but if you don't know how to use them properly, they can hurt the eardrum, scratch the canal, or push wax deeper. When you should see a doctor. If your symptoms don't go away after home treatment, or if you are at a certain risk, you should get professional help. A general care doctor, an audiologist, or an ENT, ear, nose, and throat specialist, can safely check for and remove wax. When you should get help from a professional: hearing loss, pain, fullness, ringing, dizziness, or discharge that doesn't go away. Using ears, hearing aids, or swim plugs. Surgery on the ear, a perforated eardrum, or a lot of illnesses in the past. What I did at home a week ago didn't clear the blockage. Professional ways to get rid of. Here are some things that might happen when you go to a clinic. Small suction. A lot of people think this is the safest and most accurate way to do it. A specialist uses a microscope or telescope and a low-pressure suction wand to carefully remove wax. Quick, a few minutes per ear, based on how much wax is there. Since there is no liquid, there is a low risk of infection. It's accurate, under direct view, which lowers the risk of hurting the canal. Some users say they hear noise, feel pain for a short time, or get dizzy, but studies show that these are generally mild side effects that go away quickly. There are very few problems that can happen, like skin damage, 5%, or hearing damage, 0.01%. Information on microsuction done while sitting or lying down, with a camera or microscope in place. A small probe is used to pull out the wax. Curettes are sometimes used to help with stubborn wax. Prices vary, but when you think about safety and accuracy, it's a good deal. Removal by hand clinicians can see what they're doing when they use curettes or tools. Works well with some types of wax, but you need to be steady with your skill. Microsuction can be used with it. Irrigation for health done after the wax has melted. Professionals use syringes that have been measured and make sure the water flow and temperature are safe. It's common, but it can be dangerous if the method isn't right. Some possible side effects are infection, puncture of the eardrum, dizziness, and mild pain. How often should you have someone clean your house? If wax builds up only sometimes, it's fine to do it once every few years. But if you wear hearing aids a lot, have small canals, or naturally make a lot of wax, going to the dentist every 6 to 12 months may help. During the visit, your doctor or nurse can give you personalized advice based on the shape of your ears, the type of wax you have where you work, and other factors. How to take good care of your ears. A quick list of things to do for home care. Trust natural ways to clean your ears. Don't clean them until you have symptoms. If signs show up, use drops and/or irrigation with care. Stay away from cotton buds, candles, vacuums, and curettes you use at home. If you have chronic symptoms, a history of ear surgery, an infection, or hearing aids, you should see a doctor. Once you're okay to go, keep your ears clean by doing safe things like not using earbuds, using drops if you need to, and keeping your ears away from dusty places. People often get earwax wrong, but knowing a few things about it can help a lot. Your ears clean themselves most of the time, and drops and occasional treatment are all you need to do to take care of them at home. If the problem doesn't go away, doctors can help using safe methods such as microsuction or removal by hand. Welcome to this series. Your ears do a lot of work behind the scenes. Please like, follow, and share this if it helped you. It will help more people take good care of their ears. If you have any questions or worries, please leave them below. I'm here to help. Hey, my name is Prescott. Be careful and believe that your ears are smarter than you think.